There we go. Hello, everyone. Welcome back. In the second video lecture, we're going to be covering such things as acute renal failure, kidney failure, and other things that are specific to coding diseases of the genitourinary system. Okay, so with chronic kidney disease, there are several stages, and this is based on severity, and you can see some of these things here. Chronic kidney disease and kidney transplant status. Even if a patient has undergone kidney transplants, they may still have some form of chronic kidney disease. So really important to read these guidelines. Hematuria is basically blood in the urine, and it could be from a variety of different sources, could be from something undiagnosed, could be from infections, kidney stones, enlarged prostate. And when coding hematuria, remember that it can occur on its own or as part of another condition, and the documentation will guide us to the correct code, provided you follow the instructions in the tabular. We also have acute and chronic kidney failure, and we can have sudden kidney failure and long-term chronic kidney disease. Kidney impairment can result from conditions like diabetes or hypertension. ICD-10-CM includes separate codes for acute and chronic types, and it also includes a range for chronic kidney disease stages. And again, this is the most recent way we classify chronic kidney disease. We have stage 1, which corresponds to code N18.1, and stage 2, N18.2. Please note that if you code chronic kidney disease with N18 and you don't capture the rest of the code, this is an invalid code. The numbers to the right of the digit will be the stage of the chronic kidney disease with one exception, and that's stage 3A, which is code N18.31, and stage 3B, N18.32, and unspecified stage N18.30. So the documentation must clearly state the stage for correct assignment. Coders cannot use the GFR lab results to assign the chronic kidney stage, as it's got to be documented by a provider. Remember, we don't assign codes for the most part based on lab results. Lab results are an indicator that the physician uses to determine what the patient has in the whole clinical picture. So we don't assign G chronic kidney disease codes based on GFR. A term that sometimes troubles people that are new to coding is acute kidney failure or acute kidney injury. Acute kidney injury sounds like something traumatic, but it's actually caused by conditions like blood loss, dehydration, infection that results in an injury to a kidney as opposed to trauma, right? And the coding of these requires knowing the exact clinical cause, since that influences not only the coding, but the sequencing. So you want to look at the documentation and look for terms such as hypotension, blood fluid loss, heart attack, heart failure, and so on. Cystitis is basically bladder inflammation caused by an infection. If it's caused by an infection, we should use additional codes to identify the infectious organism. Now here's a common one, BPH, benign prostatic hyper, hypertrophy, could be hyperplasia. Basically, we're talking about the same thing. This is an enlarged prostate, typically occurring in men by age of 60 years of age or older. And basically, the prostate enlarges, presses on the urethra. This obstructs normal urination from the bladder and causes difficulty urinating. Providers may document this in several different ways. Sometimes they will just use BPH. Sometimes they'll say benign prostatic hyperplasia. Sometimes they'll say hypertrophy or enlarged prostate. All these are essentially the same thing. Disorders of the breast covers a variety of benign breast conditions. This includes pain, swelling, discharge, stage reconstruction issues are also coded here. These are not related to breast cancer, right? Breast cancer we've covered earlier, right? So unless explicitly stated that they have the condition at the time of the encounter, these codes falling from N60 through N65 are for something outside the realm of cancer. PID, or pelvic inflammatory disease, covers infections of the female pelvic organs. This could be salpingitis, endometritis, and the codes distinguish between whether they're acute or chronic, so we'll need an additional infectious agent code when a specific agent is identified. And the key here is to look at the tabular. We also have non-inflammatory diseases and disorders of the female genital tract falling in codes N80 through N98, endometriosis, female genital prolapse, fistulas, cysts, polyps. And these aren't infection related, but they vary widely in severity and location. So again, this is another area where the documentation is key to direct you to the correct code. Now we get into dysplasia, right? And we have certain subcategories, right? Cervical intraepithelial dysplasia, neoplasia 1 or CIN, CIN 2, easier to say, moderate cervical intraepithelial neoplasia 2, 3, and so on. So you can see how these codes fall into that category. We also have vulvar intraepithelial neoplasia, VIN 1 and 2, and then we have severe dysplasia of the vulva, coded to D07.1 as a neoplasm. So again, what's important here is to pay attention to the provider terminology here. Now we have menopause or menopausal syndrome. This is the 12 months after the last menstrual period, right? And we have codes N95.1. We'll see additional codes in the tabular to direct for those. And the fact that a woman has symptoms as a result of menopausal process or is asymptomatic is required to code correctly. And now the last slide, we have complications as we've had with other sections of the code book, right? We have post-procedural acute chronic kidney failure. The terms in the parentheses are, of course, non-essential modifiers. They don't change the code assignment, right? We have post-procedural adhesions and so on. Again, reading at a fine level of detail and looking at all the terms is critically important to get the correct code. And that's all I have for you. Thank you so much for watching, and please reach out if you have any questions about this material. Bye now.